Call the Insurance Committee to order, September 29th, 2025. Ask, would you like to say a prayer for us?
I will.
Prayer, would you do that, please? Everybody bow with us, please.
Let's pray. Our Father in heaven, we thank you for this beautiful day that you blessed us with. Thank you, Father, for all the blessings of life. Thank you, Father, for all the many things that we take for granted every day and we don't thank you for enough. We pray, Father, now that you will be with this committee as we take care of the business of the county. Pray, Father, that you be with us and help us to make the best decisions that we possibly can. Pray, Father, that you be with this county and lead us going forward. Thank you, Father, so much for your Son. It says in his name we pray. Amen.
Amen. Thank you, Haskell. You have minutes?
Motion to approve the minutes.
We have a motion and a second to approve the minute. Any discussion? Hear no discussion. All in favor say aye. Aye. And it's closed. At this time, I'm asking for public comment or not for the presentation, but is anybody here from the public that would like to make any comment concerning the agenda on the table tonight? Hearing none, then move on. We're gonna have a presentation of two finalists, this group and your group, and I guess if you set a time, Aaron, 15 minutes, 20 minutes?
So I put them up to 30 minutes apart.
Okay.
So that you would have time to ask questions. But
Okay.
I don't
Okay.
think it'll be a problem if you finish with one, but the other group to go ahead and start.
Okay.
They may have,
Okay.
this is a pretty simple hookup, I think. So if
Okay.
they have audio visual stuff, we can make that swap.
Okay, well, our business tonight is listening to the presentations, and what I'm gonna ask is medical, you guys to step out of the room, let these folks make presentations, and I'm gonna ask them to step out of the room, let y'all make presentations, then we'll have a discussion amongst the committee. So if you gentlemen be kind enough to give us 30 minutes or so for these folks to make their presentation, we'll call you back in a few minutes here. Thank you.
Thank you.
Okay, anybody got any comments, questions before we get the presentation started? Chuck Thorpe? Please. All right, sir. Tim, over here, sir.
Right, I'd like to start out tonight by thanking Wilson County and the Insurance Committee for the opportunity to kind of go over our platform and hopefully explain to you why we're the better choice to manage y'all's employee clinic. First off, I'd like to introduce myself. I'm Tim Haller. I'm the CEO of Medical Analysis. This is my wife, Dr. Lisa Haller. She's our medical director and MRO. My background is I've been in the medical clinic business for over 30 years. I'm a military Marine veteran. My wife has had a vast amount of experience too. She's got experience in both the claims-based world, the non-claims-based world, which is this clinic. She was a physician on the Navy base for another 10 years. So, we've been on both sides. We've been in the claims-based world for many years. We saw the issues that it had. We saw an opportunity to come to the non-claims-based side and try to make a difference, and so that's what we've done. I think as you all are probably aware, the current healthcare is somewhat broken as we know it. It's difficult to get appointments. When you do get an appointment, you got minimal time with your provider. And when you do get in, often because in the claims-based world they have to stay so busy to generate visits, that often things fall through the cracks. We've experienced it personally with family members. And so we feel that that's where we can come in. We feel that we excel filling that gap, providing not only quality care, but kind of developing an atmosphere that makes people want to come to the clinic, utilize the clinic, which in turn saves the county and the county government money. Our focus is on on-site health care, and that's all we do. We don't, our model does not vary much. We do make some small changes for different clients to try to best fit their needs. But this is what we do. We like to create a culture to promote the clinic, engage the employees, promote patient compliance, and then we love to focus on treatment and prevention of chronic disease. At this time, I'd like to turn it over to Dr. Howler, who's going to kind of go over some of the chronic disease that I just spoke about.
Okay. That's an easy way to do it. Okay, hi, I'm Dr. Howler. So our mission, again, we're very, I think we excel at chronic disease management and prevention. We, of course, do all the acute care as well. We've proven, and I'll kind of show you through this, that our chronic disease management is just far above any kind of claims base, or I think anyone around, and we've had insurance brokers tell us the same things. We haven't seen anything like this. So definitely, I think we've kind of proven ourselves over the years. We also do ongoing data and research analysis. You know, what does that mean? We do ongoing data analysis over time so we can figure out what are we missing. Hypertension, diabetes, do we need to get the patient back in? We're constantly looking at this. Do we need to do better management? Do we need to discuss other medications that may need to be on the plan? Things like that. The other thing is wellness visits. How many wellness visits are we getting? Do we need to work on getting more wellness visits in the clinic? So that's what we're constantly looking at these things. I think we're very good. We have a team of people that's what we do, is we oversee. They're in the trenches working, we're overseeing everything. The other thing is we want to, like employees' dependents, what percentage are we seeing? And we give you a quarterly report. If we notice it's down as comparatively, we're going to do something to get them in the clinic. We're going to engage. We're going to promote activities. And, you know, we're constantly trying to figure out what can we do that's better. You know, the other thing up here, talking about our DNA, I think the biggest thing with us is we adjust as needed. Oops, sorry, I'm flipping things through. We adjust as needed. Again, we're proactive. We do health challenges, HRAs. We do giveaways, have people come in, maybe check their glucose, check their blood pressure to get them into the clinic, and let's diagnose these things and find them. We don't want them out not being diagnosed with diabetes or hypertension when we can improve the health of the environment. But we engage and we promote in the employee clinic. Our results, you know, medical, I know you're self-insured, medical costs are down. Absenteeism of employees decreased, that's huge as well. The quality of the employee, how they feel, and therefore the quality of their work, we want to improve that too, and I think we do a great job of that. The other thing is if we have a great clinic, it may be another kind of benefit that somebody does to stay and work for you all. We know how much it costs to recruit, hire, retrain an employee. So we want to help you out with this as well.
All right, so the history of our company. We started out about 14 years ago. Just small company, ran it on a shoestring budget, and part of our goal to this was we wanted to grow in a way that we could still maintain the small company kind of atmosphere that I think if you ask any of our clients, myself, Dr. Howler, and Todd Garlington are the three owners of the company, and you're one phone call away from reaching us. You're not going to be talking to 4 or 5 people before you get to us, and that's the way we like to do business. When we open clinics, we're there putting stuff in the clinics. We're hands-on, and that's the way we like to be. So our team basically consists of myself, CEO, administrator, Dr. Howler, medical director over all the medical, Todd Garlington, he's our marketing, customer service, customer relations. And then we have additional staff that we work with to make all this come together. We've recently hired, and we're really excited about her, we've recently hired an HR and talent acquisition lady that was actually friends of ours from the Mississippi Gulf Coast. And she comes from large service industries, 6,000 employees and stuff. And just speaking with her, she decided that she wanted to make a difference. And so she came on with us, about 4 months ago?
Yeah.
So she's been with us now, and she's making big changes, and I think it's gonna carry over to our employees that manage the clinics, and it's gonna do quite well. Our philosophy with all of our employees is we like to recruit high quality employees. We pay them well, we recruit good employees, we treat them right, give them benefits. A lot of our competitors don't do the same as we do, and for us the same as Dr. Howard mentioned to y'all. It's going to create less turnover, and it's going to create a better environment for the employees. So moving forward, this wheel, as we call it, is kind of explains a lot of the services that we offer. And the fact that we have limited time, we're gonna cover a few highlights that we think differentiate us from our competitors in this area. So I'm gonna have Dr. Howard speak a little further on that.
So I'm going to start with chronic disease prevention and cohort studies. So this is something that I developed many years ago, and what I wanted to do is find out in our clinics how well are we doing with chronic diseases. We do this for every clinic every year. So we're looking at, I'm giving you examples here, but we do diabetes, hypertension, and basically high cholesterol as well. I'm comparing two clinics that are actually clinics of ours. One that we've had for 1 year and one that we've had for 5 years now. And what I'm trying to show is that at 1 year we're making huge changes, but that's continuing to happen at 5 years, okay? We don't just go, oh, that's great, 1 year, let's go. We want to continue this over time. So what we did is, let's just say in diabetes, we took the initial hemoglobin A1C. If you're not sure what that is, it's basically an average of your glucose over 3 months. So when you first come in, what is your A1C? And then at the end of the year, your latest A1C, and we compare that. So if you'll notice, 17% is in the critical range initially. These are people that their glucose is completely out of control, probably not treated. These people are at huge risk of stroke, of a heart attack. These are people we want to reach because they are just, an accident waiting to happen. We decreased this in the first year there, 17 to 4%. That is huge. At 5 years, this is a different clinic, but again, we're still doing the same thing. What's happening is they'll come in, we're diagnosing, and we're decreasing this. So these are huge strides that we're making in diabetes. The other thing is if you can prevent one heart attack or one stroke, you've really probably paid for your clinic for the entire year. We cannot put that in a numbers, but we know it's there. So the other thing about this is, I'll let him do it because I keep messing the wrong buttons. It's not my forte. The other thing is it's kind of, some people may consider it intense, but we review every chart. So it's myself and I have 2 other people, and we review every chart and we write to the side, maybe this medication needs to be increased or whatever. And the reason is I've been down in the trenches for years, and you're working and you're day in and day out, and what we're trying to do is we can say, hey, Ms. Jones hasn't come back in because they don't have time to do that every day, so we can oversee them and do that. This is what I mean by the data analysis ongoing and for medical care. Here, hypertension, if you look at the purple sections and the red sections, again, these are people that a lot of times will end up in the emergency room with terrible hypertension. So we're decreasing that, but not just that. Anything in the green is normal, so we're at 71% of the people now have normal blood pressures at 1 year and at 5 years. And this isn't just like our best clinics. We are seeing this in all of our clinics. So we're doing a good job. The next thing is kind of going over analytics and quarterly dashboards. This is what you get. We basically we take over the years. This was a clinic over years, and each quarter we tell you what your net cost impact is going to be. Now, how do we come up with that? I can give you a whole formula, but we made this with our insurance brokers, with several different ones. And we work with our insurance group, our insurance brokers, and find out, we want it to get as close as possible for self-insured clinics. And we are seeing definite cost savings, there's no doubt. So that's what we do, and that's how we do it. We work within each group. Here's the other thing, we want to see your utilization. This is the other thing we monitor quarterly. So on the left-hand side, this is 3 clinics. This, again, an example. And this is, I look at Q2 from year to year. Those are the employees using, these are the employees eligible. And you'll see we have people, clinics from 400 to 1,500, so it just depends. On here, this green and purple, it's 2 clinics for one company, and they're moving the employees from one to the other. But, they're utilizing the clinic, and that's why you're seeing that crossover there. But, and this is just another one. How many visits are they having per person? So in Q2, we're seeing anywhere from 2 to about 5. They come into the clinic. They like to come into the clinic, and we want them to come in so we can go over their chronic diseases and things like that. We're not prevented by insurance. You can't see them, but once every 10 days, blah, blah, blah. We want to make them better, and we want to get them back to work too, and they don't have to go for it. This is work comp. Now, we excel at this too. As far as work comp, we take work comp injuries. We worked with one of our big corporations, and they said, look, we want to get these work comp injuries down. So we worked together. And we did prevention and worked with them. And you can see we had a little outlier here, a little extra few. But generally, you see a downward trend in work comp injuries. And they even took, and it was for a general work comp visit, they found out per year it's like $8,000 per person. We use $3,000. And we are saving a tremendous amount of money for that. Our people are particularly trained for work comp. So.
All right. So we'll start to bring this thing to a conclusion. So the big question is, so why medical analysis? I think a couple of the big differentiators for us that make us different than others is we're not affiliated with any hospitals, doctor groups, vendors, or anything. So by saying that, when it comes time to refer your employees, our patients somewhere, we will refer them, we try to keep them obviously in network, but we refer them to the best provider of their choice or somebody we recommend. And we feel that that's extremely, extremely important. Being independent of anything that would sway our decision is also extremely important to us. We've had many different groups, hospitals that have wanted to partner with us, and it just that's not our area, and so we try to avoid that. Our focus is on the care for your employees and your population. So we're not distracted by other businesses that we do. We do near-site and one-site clinics, and that's what we do. We think we do it very well. Our programs are customizable. I think probably in the RFP y'all saw, there's a lot of things we can offer that aren't necessarily offered in the claims-based world. We base our programs and things like that off the data that's collected from the patients. And like Dr. Howard said, when we see these trends, when we see these issues that are popping up with your people, we'll get with you. We obviously don't disclose HIPAA or patient information, but we'll tell you, this is what we're seeing in the clinic, this is what we're seeing a lot of. We need to address it, this is what we suggest, and we can move on from there. A lot of ways you can do that. But I think the most important part is that you've got an actionable plan from the data that you get. And we feel we do that fairly well. So a lot of things we do are just initiatives when we see them. We do women's health, men's health, smoking cessation, mental health support, obesity lifestyle counseling, anything that we notice that, and even if it's not a big problem, if it's somebody that needs it, we do it. And these are just a few that I've named off. I mean, we're pretty good at coming up with different initiatives to get the people in that we need. Engagements, as Dr. Howard said earlier, it's very important to make the employees feel like that this is their clinic, that they can go there, that they're going to get good service, and that we're going to do things to bring them in. We're not just going to sit back and wait for people to come, and you know, our nurse practitioners won't be sitting there twiddling their thumbs waiting. We'll go out and we'll find them and we'll engage them and try to get them in. We do that through wellness screenings, health risk assessments. You know, we have the ability, and you'll have access to a platform that if you choose, you can do 10,000 step challenges, you can do weight loss challenges, you can, there's numerous things. And when you combine that with incentives and giveaways, then it even makes it more attractive. Vaccination flu drives. This is the time of year we are full steam at all of our clinics right now doing flu vaccine drives. We go on site, we do them in the clinics. Whatever the client needs, we do our best to accommodate and get those out. Thing I hate most is at the end of the year sending back vaccines that we didn't use. And unfortunately, it happens sometimes. But when the client's engaged, it makes a ton of difference. So I'm going to pass things back to Dr. Howard to kind of wrap things up, and we'll go from there.
So, yeah, we're getting to the end here. So basically, I want to tell y'all just how we all work together. So we have a nurse practitioner in one of our clinics. This one was in North Mississippi. And she called me, and this was a Friday afternoon, and she said, Dr. Howler, she said, I have an 8-year-old, and he doesn't look right. I said, well, what do you think's wrong? He goes, I don't know, he's real pale, and he's almost gray looking. I said, well, she goes, he's acting okay, but he doesn't look right. So I said, well, let's, we sent him somewhere to get a hematocrit, basically a blood count. And it was like 4, whereas normal is like 18 or 20. So she said, all right, well, what do I do from here? So we called, we got him into the emergency room. They ended up sending him to a children's hospital. And to this day, this was about 3 years ago, she still calls that nurse practitioner, it gives me chills, calls that nurse practitioner 2 or 3 times a year and thanks her. And they did. They said if your son had gone home over the weekend, he'd be dead. And he got something called hemolytic uremic syndrome. It happened over a couple of days, and this child is alive today. And he's had a rough go of it, but if she had not caught it, he would have died over the weekend. So we do work together. Again, this is 100% what we do. I hope you can tell I'm very passionate about this. We could probably go make tons of money maybe somewhere else, but when we started this is what I want to make some kind of difference. I think we do. That's what I mean by data and outcomes driven. I didn't want your eyes to roll in the back of your head. This is what we do. So, but anyway, thank you for considering us. We would love to manage a clinic for you here. But, you know, at this point, I just, again, thank you, and we're open for any questions that you may have.
I want to make a comment, probably should have made it on the front end. When we first opened our clinic, Holly Bill, 10, 12 years ago, whenever, when former Sheriff Terry Action, I discovered one. We had a lot of problems with the employees wanting to go. We almost had to beat them with a stick to make them go to clinic. Now they love it. We've got a relationship between our providers there
Right.
and the patients, and it's almost like a doctor-patient type relationship. We want to make sure we maintain that kind of relationship, whatever we do, because they call them just like you were talking
Right.
just now, you know. So questions from the committee? John?
We have employees that work there now. Would you retain them, or would you just bring your own in?
Yes, sir. No, we will retain them. You know, that was clearly spelled out in the RFP. We've done it both ways, and it's totally dependent on the client. Y'all made it very clear. We have no problem. Seems like the patients, you know, love their providers and love their staff. So we have no problem bringing them on. I think it was fairly well spelled out, what y'all expected of us on that. So we expect to honor that.
That makes it easier on us.
It does.
You know, it does. If you love them, I mean, we've had some people like, no, we don't want that. My understanding is you love the people that work
Sure.
with you.
Sure.
So, man, that is awesome for us, you know.
Other questions from the committee?
I have another question.
Okay, go ahead.
Now, no, I didn't see the RFP, but do you charge per employee that we have, or per patient that you treat?
So the way it was set up, and the way we typically do that is a set fee, is a base fee, which wound up, I believe on y'all's, I think it was $46 a month per employee, and eligible employee, their spouse's independence. So, you know, a lot of our competitors will do a majority of their fees will be pass-through cost. And we just found that most employers appreciate the fact that with our, when it's just a pass-through cost, I can go hire a nurse practitioner for $100 just because it's hard to find them. But when it's not a pass-through, it's a fixed fee for me, I'm gonna be looking for the best cost, because, you know, I'm looking just like y'all are. I'm looking not only to provide good service, but we also want to do it in a cost-effective manner. So yes, yeah.
And we don't, and the other thing, and I think you say, it's not like, okay, this time you have 950, tomorrow you have 1,000. I mean, you know, it's
Yeah.
flat for up to a certain amount,
And there's
not
no
every
copay.
single.
There's no copay.
not,
That's what I mean, there's none of that, right?
Mm-mm.
And the absolute only time anything would ever change in that, and we have had that one time, and when utilization gets to the point of consistently being around 80-85%, that means some people are having difficulty getting in.
Right.
And so we approached the client and we told them, clinic is full, which is a good thing. However, you're having staff that's saying that they can't get in. And so we simply addressed it by working with the client and hired an additional PRN. We won't increase any cost without going through you and without having approval.
And appointments will still be required, correct?
But, so
I mean, you have walk-ins?
what we say is it's walk-ins by availability.
Okay.
And the reason we say that is because on a day where we're completely full, I don't think you want me pushing you off to get somebody that just decided they wanted to walk in
I'm not
today.
asking to do that.
So we do, we have online scheduling, they can call to schedule, you can walk in and ask, and we can tell you, you know, you can wait, and probably in about 30 minutes we can see you, or come back this afternoon, or maybe it, you know, we're totally booked up today. You know, we can see you first thing tomorrow, but I don't think very many people we ever see go longer than 24 hours
Oh, yeah.
without getting their appointment, which I think is a key thing.
Other members of the committee? John, do you have another question?
Good
You're looking at your
question,
notes here. I'm
Well,
just
I mean, you're gonna provide a report every quarter.
Mhm.
To whom? to this committee or to?
Whoever you tell me to.
No, I'm just wondering, because, I mean, that's good to provide a report of the court.
Yes.
I like that.
We, and we'll provide it to y'all, and if he tells to provide it to somebody else, we'll do that too. But honestly, we like to keep up with that because it gives us stats of what we need to be improving. If you wait till half the year, you're kind of behind that 8 ball, as they say.
And the
so-
pharmacy is included also?
Yes.
Certain medicines, not all medicines?
Yes, you know, if we get a contract, we basically will sit down with y'all and your insurance brokers. We'll look at the primary medicines that we need, and that's what we'll, you know, stock
Understand.
and put in the clinic.
Okay.
Other questions from the committee? None? Not gonna open this up to the public, but does our insurance staff have any questions? No questions? Well, thank y'all for coming.
Thank you.
We appreciate it.
I appreciate it.
We'll take a 3-minute or 5-minute
Appreciate the
break
plug
here.
in. All right.
Thank you very much.
Guess we'll send in.
We'll get them in here.
Okay, all right.
That was your job at one time, but. Yeah, that'd be good if you go.
Still got it in you.
Okay.
All right, thank you.
Thanks again.
Bring back the old days. huh?
There you go.
Thank you very much.
Thank you very much.
Are y'all ready?
Anybody wanna do any discussion? Wait, anybody want any discussion on the committee here? No discussion? Diane, you wanna do any discussion on this group? At this point?
No, but we'll be like talking about it.
Okay, all right. Yeah, bring the other group in if you would.
Right.
Move on.
That's what we're supposed to do.
Talk about it.
Yeah, that's what we're here for. Matter of fact, I'm surprised we have a closed meeting.
Sir?
The open meeting. Open meeting law. And we weren't even allowed to do that way either.
Come in, come in. Come in, Dr. Bill.
All right, thank you.
Do we have anybody else coming in?
Just the ones lost up here.
There's a crowd.
Okay, we've had our first presentation. This will be the second and final presentation, then we'll have discussion on it. We've got medical associates, so with that, who's gonna be the presenter?
Guess we all will.
Okay.
Come on up here, guys. We only got to stand 15 minutes.
You gonna introduce everybody? You brought the whole,
Yeah,
whole gang with you here.
I'll hand these out. Rod, just go ahead and tell them just a little bit of the background and I'll.
So I'm Roger McKinney, I'm a hometown boy, I grew up here, went to school here. When I got out of medical school, I came back here in 1980 and joined Dr. George Robertson, who is Bill's father. So we started practicing here in June of 1980, and we've been practicing since that time. We went from College Street up here, and then we moved down to UMC Hospital and the health office down there. And it's been called Family Medical since 1980. There's 5 of us doctors. One is not here, Dr. Reed, he's a hometown boy too. And we have 7 nurse practitioners, our PAs altogether. So there's 5 and 7, there'd be 12 of us. And we've been practicing medicine here. We're open Monday, Tuesday, Wednesday, Thursday, Friday, and half a day on Saturday. And we're all primary care physicians. I used to deliver babies. I delivered about 1,500 before I quit, and I delivered some that are in here too. Yeah.
I was gonna ask, how many's in here that you delivered, so.
Well, I can't, I got so old, I can't recognize them. They don't look. Like I said, I delivered them 45 years ago, and it hurt my feelings. I didn't know I was that old.
Yeah, we're honored to be here. Thank you for inviting us up and just for the chance for us all to get to put some names and faces and let you know kind of our hearts We really appreciate the commitment that the county wants to make to its employees. And in doing so, 20 years ago, I guess it was Terry Ash and some members of this committee had the vision to say, how can we keep our county employees healthy and keep them working? And so y'all started a great clinic. You've had a great clinic. You've got a great staff. You've continued to do things with excellence. And in this next season, we just want to be part of that success story. We do offer some things, and we have some unique skill sets that really nobody else, definitely Wilson County has, because of the quality programs that we have. Since 2016, we've had over a 90% star rating for quality measures. And so your average medical clinic is not going to check quality measures, and they'll be nervous about reporting to anybody to say how good you doing, right? But we do that openly because we feel like it gives us a chance to improve and make sure we know that we're taking good care of people. Through these programs, we've been able to save Medicare $7.4 million over this last 8 to 9 years, and that's real money. So it's not just about quality, it's about being responsible. And so we want to be able to get your employees back to work quick and back to work well and do it with excellence. Yeah. Any thoughts you have, Dr. Crutcher?
So I'm Sam Crutcher, grew up here in Lebanon. Some of you may know my parents, Johnny and Ramona Crutcher. I've been with Family Medical for 15 years now, and plan on being here as long as I can.
So we've been honored to be able to grow, like Dr. McKinney had stated, over the years. And when Dr. George, my father, started this practice, I don't think he realized the legacy that he and Roger, Dr. McKinney, would have created. And so, we take a lot of pride in that, as y'all take a lot of pride in what y'all do and how y'all do that. Bernie, you introduce yourself?
My name's Bernie C. I've been in the area for 18 years. Married, I have my wife Christine, we have 4 children. I went to Vanderbilt for undergraduate, have an engineering degree from there. Really love the area, spent a lot of time here. My parents are from the Mississippi Gulf Coast, and true statement, my dad was a pediatrician there. I was hoping to move there, but then in 2005, Hurricane Katrina kind of messed that up. So this is my new home. Hope to be here for the rest of my career and hopefully the rest of my life. I really enjoyed serving this community. I stay active not only in adult medicine, but pediatric medicine as well. I spent a lot of time in the hospital helping in the nursery. Also helped locally with 5 different pregnancy care centers, namely in this community, the Pregnancy Care Center. Some of you might know about it. We just had our recent gala banquet, fundraising banquet. Really, I'm a personal advocate for young mothers and the right to life. So also served with Jim Teva Hospice locally, as well as help as the medical director at Lebanon Rehab and Smith County Rehab. So stay busy, stay involved in the community. I believe in comprehensive care. I believe in our team here at Family Medical. Stand behind it. I feel like we all give competent care, but also a lot of caring in our office. So I hope that you can trust us and give us the opportunity to help serve you guys through this clinic. Really excited to be here. If you need anything, let us know. Okay?
The relationships that Dr. C has built since he's come, it's just enhanced our practice. And it's not dissimilar to the relationships that your staff has formed with your employees. I mean, you've got a bond there that really, really helps not only to expedite care, but helps get them better more quickly because they know they can trust them. So what we want to do is make sure that, the excellence y'all have in place with this fantastic staff, that relationship just continues to grow. And as the county grows, your county employees will grow. And so you've got a great framework there just to continue to enhance that, which is great. Kyle, our office manager, has been with us now a couple years, has a couple points, and he can kind of let you just take a quick run through with your handout.
So I just want to reiterate kind of what they've already said. We are here, it's very straightforward, we're local. All the providers are here in Wilson County. Most of our staff is in Wilson County. They've been here, they pay taxes, they shop here. They're integrated into the community. So we've got, and that's providers to our front office, to our nurses, they're all here. Everybody that you guys see at your county clinic are people that our family medical group knows in the community. So one of the things with this packet that's there is you can just kind of parse through it. One of the things I wanted to highlight is that we've got providers, these guys right here, who were, voted best of the best in Wilson County, and that happens year after year after year, that we've got them as points of reference for that, for our patients, and you'll see on there some of the clippets from kind of online social media, and that stuff counts when people look at it and they want to know where they're going to go for care, and if they know that this group with these doctors and these other nurse practitioners and PAs, that's part of the group that's running this county clinic for you guys. I think that's important. It also shows longevity. I just got a clip where we kind of reward and kind of give out accolades to our staff that have been there for certain work anniversaries, and so that's just kind of highlight all of our staff. We have 12 providers total. We've got close to 50 support staff, and that's from front office to billing to nurses, MAs, you name it. And they've been with us a long time, and that doesn't happen just by chance. These guys have been there a lot longer than I have. I've been with them for 2.5 years, but we try to create an environment that fosters longevity, and we want that for your staff that's at that county clinic, because we know that that's important to you guys, is to keep them and keep that consistency going, so that way you've got the same people there that are taking care of your county employees, because we want to be sure that we can get them in and out and get them back to work. I know that's a high priority for you guys. We feel the same way from staffing. We want to get our, it hurts when there's somebody missing for the day, and so we want to help you guys get those people in, get them treated, get them the medication they need or whatever kind of care they need, and get them back out into service for the county. And so we want to keep that the same. We want to keep your employees the same. We want to help them feel at home, and we're going to incorporate them into our structure so that way they are consistently involved in everything that we do. We're going to make them part of our own. And so we just wanted to highlight that. Want to highlight the fact that we're right down the road. We're 9 minutes away. And I think that's important too. When you guys need help, your providers are on staff, they've got a question about a test result, they've got a question about there's an urgent situation with somebody. I've got 12 providers 9 minutes down the road. So if they need to get to them, they're right there. They can call them, they can come see them, whatever they need. If they need access to me, I'm always on my phone. I've got all these employees, they're calling me all the time. So I'm just a phone call away as well. We do have the on-site clinic there, so if you've got employees that need to get in, but the county clinic is full and they need to get over to us, we can work them in. We do walk-ins anyway. We'll make it a priority to make sure the county clinic staff can get in. We do on-site x-ray. I know right now you guys have to send them out for imaging to other places, so when they come over for us and they do their visit and they need a chest x-ray, we can do it right then. So there's a lot of benefit to that. We just got a really good group, and so that's one of the things I just wanted to highlight in there for you. Dr. McKinney's been doing this for close to 50 years. 45, so close to 50.
So I wouldn't say it out loud.
Yeah, he knows, we're integrated in this community. So that's the big takeaway that I want for you guys, for us, is that, we work here, we live here. This is where, we're part of. And so we just want to take this next step and help you guys and kind of keep things moving along as it has been, and try to save you money. I try to work with every day, and they'll tell you I'm always looking at ways to save money and try to work out deals with different vendors and keep the quality the same, to find a way to save money. And I know that's important to you guys as well, and so we've got good partnership with different vendors, whether it be for medical supplies or office supplies, that we can work with and cut deals. And if I don't think a price is good enough, I'll call them up on the phone and I'll say, hey, we got to do better on this. I'll price match it, quote it. So my goal then is to help you guys as we send those invoices back to you. I'm going to work hard to make sure, I'm not going to take that for granted. I'm going to make sure that we're getting good prices on all the things that they're going to utilize over the clinic. So we're open up to any questions that you guys have about the clinic and operations.
Cal, I think you answered the question I was gonna ask there a moment ago. But I know Dr. Bill has clinic experience, has his own clinic. You guys function pretty much as a walk-in clinic at your office there. But If you guys were awarded the contract, who would be directly overseeing our existing personnel?
That would be me.
Be you?
Yeah.
Okay.
Yeah, like I said, I'm right down, around here.
And
so
you would
if anything-
integrate your staff with with the existing staff?
Yeah, we actually already transitioned over to a new HR software platform as well that will help them stay connected even more, and streamline things a little bit. But we have all the capabilities ready to bring them on board and help.
I stated to the other folks who made their presentations, and just say it again, it'd be on the record that it took a long time to get our employees to want to go to our clinic. We had almost had to beat with sticks or booty whips or whatever, but now they love it, and we don't want to let that relationship between the employee and the providers to be broken. We want to make sure that that's still there. So, question for the committee, from the committee. John?
Sure.
Sure, there you go, John. He's there for us.
Okay, I'm retired. Okay, so the process would be, we'd go to our clinic, I mean, our employees would go to our clinic, and they'd be referred to you, one of the doctors here?
No, so, okay.
Or how's that work?
So initially, we're gonna leave it the same as it
I
is,
know,
so they're gonna get in
you're
there
going
and
to
you
the
guys.
clinic, and you're normally gonna treat them at the clinic, but if they have something that needs
Yes.
more,
Yeah, so then your staff, they would call us, or if you guys are booked and they can't get them in, but it's something that we need to get them seen that day, then they can definitely call over to our office, we'll make a channel for that, and we'll get them in and streamline that.
okay.
We try to make sure we've got providers that don't have a schedule, or that have had very thin schedules, so they can help grab these walk-ins as they come.
Okay. And would that add to the cost of our clinic then?
So, I think as you guys had before, there was a fee that would be billed if those people
We
were
have
sent at a
outside
separate clinic.
Exactly.
Right, yeah. And so that we've got that included in the initial proposal
And
for you.
the pharmacy would be normally at our clinic for certain medicines, it'd
Yes.
still be there, right?
Yes. Yeah.
Dr. Sam, you had a comment?
I was gonna make a comment, you know, we're not trying to break up the relationships that people have with their providers, and so we're not trying to swoop in and say, now you have to see us
Oh, I
personally. So we wanna honor any,
Right.
relationship that people already have. That being said, we want to take care of people, and so if it's a situation, hey, we have a person here, we don't think they need to go to the ER, but they need something that we can't physically do here, we want to make ourselves available for that patient if that person is willing to come and see us.
So if they can't be treated totally in the clinic, that
Right.
place to go. And you're in our network for our insurance, correct?
Yes.
Yes.
Okay. Which is important.
That's a great question.
Another question from the committee? Nate? Ask them.
So if one of our employees did need to, say, go to your office to get an x-ray, that would be, how would that be billed?
So we've got kind of based in there a flat line fee. So you really kind of have two options, it depends on what you guys want. I know that when your health insurance plan gets utilized, like that we're a
Right.
network with, that can raise your rates. You don't want that. I'm sure you guys are you self-funded plan, I guess. So you would prefer it probably to be a separate fee and not billed to the insurance. And so that's why we've got that in there for you. So we've got a flat fee that can be billed for the office visit and the x-ray combined in there if they do come and see us. Or they can bill the insurance. Really, we can work that out with you guys on what your preference would be.
Well, we insure ourselves,
Yeah.
so we pay the bills, but we have a gatekeeper, of course.
Mr. Kurt, question?
No, sir.
Okay. Eric, you got any questions?
No.
Again, I'm not gonna open it up to the public, but does our insurance staff have any questions, comments?
Thank you very much.
Thank you.
Jerry,
Yes,
one
sir.
of those things, the nurse practitioners, if they see somebody and have a question, they can just pick up the phone and call us. We're happy to talk to them anytime. There's somebody in the office all the time. We're there till 7 o'clock on Tuesday, Wednesdays, and Thursdays, 5 o'clock, and half a day on Saturdays, and we're happy to speak directly and give them whatever aid
We're on
they
call
need.
too, we're available even after hours that we would answer, we available.
27 hours a day.
Yeah, that's it. So it's about right.
Sometimes it appears that way, right?
Yeah.
Thank you very much.
Thank you.
Okay.
Thank you for that.
I appreciate
Thank
it.
you. Yes, sir.
Thank you.
I appreciate it, thank you.
Thank you.
Thank you. Appreciate you. Thank you. Appreciate
Do
you.
you have anything, Aaron? Do you have any comment or question?
I appreciate you.
Thank you. Look forward to chat with y'all. Thank you.
I'll say you wanna do it. Stay there. A lot of hugging going on. Y'all on TV, you know. No, I got my
Didn't live about it.
Okay.
I just told you yesterday.
I think I'm ready.
Okay. That is
It's hot in here.
Came to an insurance meeting and a Coldplay concert.
Well,
You've been waiting. Waiting.
He has sat on that one a while.
I remind the committee, we're still in session, so discussion and selection is the next thing on the agenda. Discussion, please.
And this may be more for the staff, workers' comp, the availability for them to be part of, either group to be part of the panel, that is possible, right?
It is. Sheena, when she had the clinic, she thought it was a conflict of interest to do work comp and, be our employee clinic, which really, I think that's just a preference on who's running the clinic, so.
Because really, I mean, there's no information shared, it's totally
Correct.
separate.
Correct.
And the other question is, employee drug screening, MRO, that type of thing was run through the clinic before. And I heard Dr. Holler mention she was an MRO. I would assume Family Medical could be an MRO as well,
I would think
right?
so. I would think so. It would help sometimes if we could utilize the clinic for work comp, because there are times that any Care 24 is all we have, so it would be nice to be able to do that. But like I said, I think it's just the preference of who runs the clinic of
Sure.
whether they do the work comp or not.
Anything's possible. Any other comments, questions, discussion items? John?
I had a question. Well, that's okay.
Never mind.
Never mind.
You're one question over anyway. So.
I know, I reached my limit.
Okay. With that said, Chair, let me make a motion.
Well, just a minute, I do have a question, I just remembered.
You chair,
On
put the
the
motion on hold.
first presentation, they said they would deal with chronic, like high blood pressure, diabetes, and they would get this by having advertisements of health get-together, where like every year we seem to have a program where people can get their blood pressure
Health
checked
fair.
and all this, health fair.
Yeah.
Now, do you direct that, or do they direct it?
We ask that the clinic come and do the flu shots at the health fair. Usually when employees come to the health fair, that's the main reason they come, is to get that flu shot. But the clinic has always been good too about if they couldn't make it to the health fair, they would let them come to the clinic after the health fair. They try to give the flu shots to all employees first and then make them available to the dependents after that.
Okay, but the chronic illnesses like high blood pressure?
Yeah, they would do that if we asked them to, yeah.
Okay, so that's what I asked, because the second group didn't mention any of that, like soliciting the employees to come so they can test them or anything like that.
Right.
So we would do that, and you guys would do that or direct that or ask them to do it, correct?
Yes.
Okay.
Some of this stuff is up to you. One year, 6, 7 years ago, we insisted that everybody get a blood draw. You would have thought we asked for a finger.
Oh, I know.
But all we asked for was a blood draw to try to determine where our the
Well,
health-
I wouldn't direct them to do it, I'd say it would be open to be tested and things like that, kind of like an health fair. You could include it in the health fair. And
Yeah,
and if they wanted to do it, fine, but I don't think you can mandatory that stuff.
yeah.
Since we're self-insured, either way, vaccinations, whether it's flu or whatever else, it's pay one place or pay the other place. I mean,
Exactly.
you're gonna pay a pass-through cost here, or we're gonna pay it over here anyway.
Yeah.
So,
Vaccinations are covered at 100% anyway
Right.
through the insurance, so it's either you pay one
a
or pay the
pass-through
other.
cost,
Right.
or we're gonna pay it out of pocket through our
Right.
insurance.
But I was just referring like a stroke is gonna cost the county abundant money.
Right.
So if we can do some kind of
Preventative.
preventative things, like the first group suggested, or that they advertised they would do.
Yeah.
And I just want to see if we could direct.
And I'm not one of these people who likes draconian wellness programs, but if you're going to, identify the risk in your population, you almost have to, practically insist. I'm not saying we're going to, so dismiss what I say as soon as it comes out of my mouth.
Oh,
You
I
almost have
understand.
to insist on gathering data
Well,
to
that's-
know whether somebody is A1C is over 10. If they're not gonna give you their blood, you're not gonna know.
No, you're not. And if you go to the clinic, you can't mandatory that either. You can't make that mandatory.
At least you can offer incentives.
Yeah, you can offer
Prizes,
incentives.
door prizes.
Sometimes those
Yeah.
incentives take the form of sticks, but you
Right.
can offer incentives.
I think we need to keep an open mind that we need to be flexible, no matter which way we go, and
Exactly.
provide the best for our employees. I remember many years ago, we gave flu shots up here at the second floor years ago. So,
Yes.
you know, so we just need to remain
You can
flexible.
go to the, you can go to the grocery store and get a flu shot.
There you go.
Yes.
Chair will entertain a motion.
To recommend one or the other?
Dang, you're trying to speak, you
Well,
just
don't
don't say.
everybody jump out there at once.
I can make a motion, but I think Haskell's getting ready to make one.
I was waiting for Diane to get here and spit it out.
Y'all better hurry, back it, or I will, so.
I make a motion for medical analysis. I just think the preventive side and everything that they proposed, and my knowledge of, and again, I don't get anything at all, but my knowledge of how they run a clinic with no attachment to anybody else, I'll just make a motion that we award them the contract.
We have a motion.
I'll second
We
that.
have
I
a
agree
motion.
with that.
We have a motion and a second. Put to a vote.
Sure.
All in favor, say aye.
Aye.
Opposed, nay. Nay.
Okay.
Chair would like to, feels like a vote. Would somebody like to make another motion?
Well, we only have two choices.
I'll make a
I mean, just
motion.
make a motion the other way.
I'll make a motion the other way for family medical.
We have a motion for family medical. Do we have a second?
Second.
We have a motion and a second. Any discussion? All in favor, say aye.
Aye.
Aye. Got an aye all the way around, unanimous? Okay. With that, I'd say family medical be awarded the contract. Comments or questions or corrections, Aaron?
No, I will let Sheena know. I will get with the people from Family Medical, and I assume that I'll get them coordinated with Sheena as far as the handing off of operations.
Sure.
Now, when do they take over?
That's what I was just saying.
We don't know.
End of the year, ain't it?
Well,
Well, we don't know.
I think it will be before the end of the year.
That's what I was thinking
We,
too.
we told Sheena and them, Health Resource Integration, they were willing to go through the end of the year if necessary. But I think, if they're able to work out again, they don't wanna just walk away, but to the degree that they need to coordinate with this new group coming in, if they can get that done in 30 days, I'm sure they'll be happy to be gone, 1st of November, end of November, whatever's needed.
Well, maybe we should direct this group to work with them to transition and get back to us with what the plan is and when it's gonna
Absolutely.
change.
We also have to have a contract, and I know Mike had suggested that they draw up the contract and give it to us. So basically, I think it has to be pending, the motion that was just made and approved has to be pending
Approval of
the contract.
Approval by both sides.
Y'all tell me if I'm wrong with this, but I'd really like to, this thing go as smooth as possible. And I think that would need to be that Kyle and you and probably the person from over at the clinic and all get around your desk or somewhere and Sheena
Yes.
and do the pass off and what's happening and just share the information,
I'll work on getting that meeting coordinated.
so everybody can
Now,
do it.
do any of our insurance people need to be involved in that?
Absolutely.
Yeah.
Okay.
Yeah, absolutely. I always like to have them in the room when we're doing these kinds of things. So,
Especially if they go to the other clinic and we're billed for that, we need a process there, okay?
We've had a similar situation before, so,
Okay.
it's not new, but we do need to have all our, protocols in place.
County attorney needs to be at that meeting as well.
Did we?
No, not yet.
Mainly, I think what we need the county attorney for is just to review the contract. Yeah,
After the fact.
after the fact, yeah. As far as what I'm primarily concerned about right now is transitioning the operation from one to the other. What do they need from Health Resource Integration to support? How long do we anticipate in terms of a transition timeframe, those kinds of things? That's my
So you
primary
need the
concern.
contract first.
We need the contract as soon as we can get one, but we'll have to reconvene when we get one after Mike's had a chance to review it.
Yeah,
So-
I'm thinking you can't transition until after the contract.
Do we need to have another committee meeting, official committee meeting, or just a
Accept the
transition?
contract.
We will need to have a meeting to accept the contract.
Okay.
Yes.
That's fine.
Does the county commission need to accept the contract?
I think they probably will, but I will defer to Mike on that, but I think they
I
probably will.
think they will.
So they push it out another month.
There's something telling me
It's
that
gonna
the
be-
I
county
think I thought Mike
committee.
said last time that this committee,
That's right, that's correct.
I
This
think he
committee
said
made
that
final
this
decision.
committee could approve that.
That's correct.
Yeah, I think
Since
you're
we're
right.
elected in the committee, I think you're right.
Yeah, I think you're right.
At the finance.
That's why I said I defer to Mike on that one.
Because we were talking about the timeframe.
When will he be back in town?
He will be back Wednesday for a few days, and then he will be gone again until.
Do you control his calendar?
That's a touchy subject. No, I can help
With the
him.
exception of UT ball games, you control his calendar.
Oh, it's fall break next
What do we?
week.
Yes.
Can we get another lawyer to review it if he's not available?
I don't think that's.
Danielle.
Mike's a lawyer.
I'm not.
I mean-
There's no way.
Come on, Mike.
Hey, we got a lawyer
I
on the
didn't
staff
know.
here.
I'm definitely that in my real job.
I'm still gonna get Kyle and Sheena and everybody together.
Yes,
And
yes.
I'm still going to work, look,
I'm confident we could do it.
you're right.
Let's call this a conference so we can just confer in your office.
Please.
Or talk, wherever.
And really, I think the idea of us not being able to come up with a contract everybody can agree on based on the proposal and everything else is highly unlikely. So I would be willing to move forward in the transition, and if we have to, we say, okay, no deal. But I would move forward.
It'll be the middle
Will you
of
take the lead in that
I will.
sometime?
Yes.
No? Okay. I'll jump in
I
if
don't
you
feel
want.
comfortable without a contract, quite honestly.
Well,
I've seen things like this happen before, and then you got so many in
I think
there.
we have until December 31st.
I think so,
Yeah,
too.
so I don't think we need to.
We have
go
until
rush it.
December 31st, but I get questions quite often.
Will you-
Say the end of
Are we
October.
ready
You
yet?
ought to be able to do it by the end.
The contract we're working on right now was renewed once before. It's not a brand new
Yeah.
contract. I mean, it was renewed once before,
So why don't
so.
we just have the contract
Template's
now
there.
and look at it and.
Well, it's a different contract. It's the contract we're under now. not under-
Right.
Right.
But I'm saying that template's available. I mean, it's.
Oh, the
will be at
template.
my
Yeah, the
time.
Yes.
template's there, and we've modified, put the,
Okay, well, you set up the
I'll get
informational conference and we'll go from there.
I'll get it going, yes, sir.
Old business?
Just one other thing, as we're
Yes, sir.
talking about that contract, I would like it specifically to spell out how the medical review and also the workers' comp.
Okay.
Because I think the workers' comp, I think is huge for
yeah, it
the
is.
county. I think it could save us a lot of money.
Because our worker comp index goes up, it costs us a lot more money, which it did this last time.
I tell you what I'd really like to do, once they're on board, is to study the pharmaceuticals over there, see which ones are being used and which ones are not, and which ones need to be added to. We'll probably delete some and add a few, but anyway, that's neither here nor there.
Just for clarification, I apologize. When you say a medical review, can you tell me?
I think the
specifically?
drug screen process, because I don't know, it wasn't mentioned, and I should have asked that question with
Gotcha.
Family Medical Associates, just how they're gonna handle the
You mean for
the
hiring?
medical review officer, because the nurse practitioner would, if there's a positive, and how we follow, I assume we follow DOT standards and that type of thing, I'm so right.
Okay.
So you set up the meeting, we go from there. New business, old business, anything further, one more motion?
Adjourn.